Go ahead.
Today we're having a conference on affordable health care. We have quite a few of the women throughout the San Bernardino County that are here, some from outside of the area, and it's basically informing them of the health coverage, not only for pre-existing conditions, but when it actually took place and how it will also benefit them not only now but in the future. And it's important that they know what they're entitled to and the benefits that are there, not only for pre-existing conditions, but also for a lot of our seniors in the donate hole area, and then how it'll also help small businesses or individuals or nonprofit, when it'll actually kick in, types of tax credits that they're entitled to. In the area, there's a lot of misnomers about the affordable health care, and I think that people were saying that the insurance rates are going to go up. Well, they won't be going up in terms of the future because there'll be the accountability, there'll be the oversight, there'll be the transparency that has not kicked in yet. And right now, it has benefited millions and millions of people, especially a lot of pre-existing women who have had, or individuals who have had pre-existing conditions. They won't be able to be denied coverage anymore, so a lot of them will feel a lot safer knowing that they have health coverage. There are too many people here that will now be able to say, look, I'll be able to put food on the table, take care of my family, and not have to worry between health coverage and not, and especially for a lot of our seniors in the donut hole area, is that the benefits that they'll also be able to receive, because once they exceed the $3,400, is that they'll get a $600 savings, especially for prescription drugs right now, and generic prescription drugs. So this will help them.
Congressman, could I get your take on criticism on the Affordable Health Care Act and efforts to repeal the act?
There's a lot of criticism because the insurance companies want to monopolize and take control of it.
Yeah.
And they know that the insurance companies is where a lot of the individuals are protecting the special interest groups. And it should not be about special interest groups or the insurance companies. It should be about health coverage for the American people, regardless of who they are, is that we should provide that. Every other country provides health coverage. We should make sure that we should do the same thing for everyone here. And that's why with the oversight, the accountability, and the transparency that will be there, these insurance companies are raising right now, can raise our rate. Look at what Blue Shield wanted to do at one point, raise it by 50-some%. It's basically saying you won't be able to do this anymore, and you won't be able to deny anyone for any kind of pre-existing condition, any kind of health coverage. It doesn't matter what you have. And that's why there's a lot of appeals on the other side, because they know very well that that's the highest cost, and they should be providing that to a lot of our individuals, our consumers, and others here in the United States, is that we should have coverage. No senior should live in fear. No young adult should live in fear. No individual should live in fear because they don't have health coverage. And we want to make sure that everybody has health coverage. We want to make sure that their quality of life is just as good as those that don't. It shouldn't be about those that haves, because they have the money and can afford to get health coverage. There are many people that can't afford the health coverage, and we have a responsibility towards those individuals, because ultimately it will be our responsibility to provide for them. And if we do a lot of the preventive that needs to be done, this health coverage will do a lot of the preventive. And we start doing that, people are going to be a lot healthier, live a lot better, and we're actually going to reduce our cost in the long run. So really, it is a saving to the American people if we do provide it now and in the future as well.
Thank you very much.